Hello, welcome to IV Therapy for the Practical Nurse, the Ohio LPN and IV Therapy Practice. Module 1 will cover legal implications and the role of Ohio LPN in IV Therapy Practice. The practice of IV therapy is closely controlled by law and rule and monitored by various organizations. Each institution where you are employed will also have specific policies guided by these laws and organizations. We will begin this unit with a legal overview, a review of legal terms, and a discussion of standards in terms of development, purpose, and use. We will then discuss legal responsibilities with respect to IV therapy and competent practice, including a detailed review of Ohio laws and rules concerning IV therapy, and introduce you to sample institutional policies that may affect you as a future IV therapy certified LPN. A brief history of IV therapy may be insightful in order to understand the need for laws regulating the practice of IV therapy and organizations contributing their expertise. Current IV therapy is less than 100 years old, yet it was known as early as the 1600s that medications could be injected into a vein. Early experimenters injected substances such as wine and opium directly into the bloodstream through a vein using a quill and bladder. Due to lack of understanding about sterility, infection control, and physiology, these attempts met with little success. These experiments were then banned, and the next use of IV therapy was in the early 19th century when blood was used for transfusions for women who hemorrhaged after childbirth. With the findings of Pasteur and Semmelweis about pasteurization and hand washing, IV therapy could then progress. By the mid-1950s, still fewer than 20% of hospitalized patients received IV therapy. Needles were reusable, and the patient's arm was restrained with leather straps and a flat padded board. Now about 90% of hospitalized patients receive IV therapy, and IV therapy is growing more common in many other settings. The practice of IV therapy and the regulations involving IV therapy continue to change. This unit's objectives include outlining the LPN's role, accountability, and responsibility related to IV therapy in terms of law, board role of the directing professional, the healthcare setting, and institutional policy. Please see the syllabus for specific course objectives. The role of the person administering IV therapy is basically limited by the laws of the state of practice. Who may prepare, administer, start, or stop IVs varies from state to state, and you have to know the laws of the state in which you practice. In addition, you must stay up to date for any changes in existing laws. In the United States, there are 4 primary sources of law: constitutional law, which is the supreme law of the land; statutory law, which are laws made by lawmakers; regulatory law, which are laws made by governmental agencies; and case law, which are precedents from other judges. We will briefly review each of these. The Constitution is the basic framework on which our government is built. It is the ultimate authority of law in the United States. A constitution is a set of fundamental principles or established precedents according to which a state or other organization is governed. Although the Constitution has little direct involvement in the area of malpractice, its principles are interwoven in both state and federal laws. Statutory law, or statutes, are laws enacted by the legislature and passed by the House of Representatives and the Senate as basic rules for society. A statute is a formal written enactment of a legislative authority that governs a state, city, or country. Typically, statutes command or prohibit something or declare policy. The word is often used to distinguish law made by legislative bodies from case law, decided by courts, and regulations issued by government agencies. Statutes are sometimes referred to as legislation or black letter law. Administrative law is a form of law made by administrative agencies such as the National Labor Relations Board and the Ohio Board of Nursing. These agencies are empowered by Congress to create specific regulation or rules to implement laws. These rules supply specifics to the general content of the law and provide procedures by which law can be enforced. At the state level, the various nurse practice acts are the authority by which nurses can practice. All states and territories have enacted a Nurse Practice Act. Each state's NPA is passed by the state's legislature, but the NPA itself is sufficient to provide the necessary guidance for the nursing profession. Therefore, each NPA establishes a board of nursing that has the authority to develop administrative rules or regulations to clarify or make the law more specific. Rules and regulations must be consistent with the NPA and cannot go beyond it. These rules and regulations undergo a process of public review before enactment. Once enacted, rules and regulations have the full force and effect of law. Although the specificity of NPAs varies among states, all NPAs include definitions, authority, power, and composition of a board of nursing, educational program standards, standards and scope of nursing practice, types of titles and licenses, protection of titles, requirements for licensure, and grounds for disciplinary action, other violations, and possible remedies. The Board of Nursing is an example of administrative law that was established by the state legislature, which mandates both the structure of the board and board functions. The board exists solely to enforce the law and rules regulating practice. The main role of the board is to protect the public from unsafe nursing practice. The powers and duties of the Board of Nursing include administer and enforce disciplinary action for violation of the revised code, develop criteria that an applicant must meet to be eligible to sit for exam licensure to practice as a registered nurse or as a licensed practical nurse, issues and renew nursing license, define the minimum curricula and standards for educational programs, survey, inspect, and grant full approval to pre-licensure nursing educational programs. We have already encountered several abbreviations that are important to know throughout this course. These abbreviations include NPA, which is the Nurse Practice Act, OBN, which is the Ohio Board of Nursing, ORC, which is the Ohio Revised Code or law, OAC, which is the Ohio Administrative Code or rule. And just to clarify, law always supersedes rule. The final source of law we will review is common law, or also called court-made law. Common law, also known as case law or precedent, is law developed by judges through decisions of courts and similar tribunals, as opposed to statutes adopted through the legislative process. Courts are responsible for interpreting the statutes, so most laws in the area of malpractice are court-made laws. Again, common law is using previous court cases to determine the law. For example, if a restaurant owner denied an African American service, the courts would look back to Heart of Atlanta Motel versus the U.S. There are several legal terms that nurses should be familiar with, which we will next review. These terms are criminal law, civil law, tort, malpractice, and the rule of personal liability. First, let's discuss criminal law. Criminal law relates to an offense against the general public. Criminal actions are prosecuted and punished by government authority, and punishment includes prison, fines, or both. An example of a criminal offense is violation of the Nurse Practice Act by unlicensed persons. On the other hand, civil law affects the legal right of private persons and corporations. When harm occurs, the guilty party may be required to pay damages to the injured person. Let's illustrate the difference between criminal law and civil law. A drunk driver, who we will call Bill, is involved in a car accident that causes the death of a mother with 2 children. Bill is charged by law enforcement with involuntary manslaughter and reckless driving while speeding and intoxicated. The courts find him guilty and he serves prison time. This is criminal law protecting society. Taking the situation a step further, the husband sues Bill for a substantial amount of money to care for his 2 children who are now without a mother. The court awards a monetary award. This is civil law. 2 other legal terms that fall in the category of civil law are contract law and tort law. Contract law refers to laws concerned with agreements between 2 parties that involve an obligation or duty. Tort law is the area of law that nurses are most familiar because it involves negligence and medical practice. A tort is a wrongful act committed by one party against another. The purpose of tort law is to make the injured party whole again, primarily through compensation. Torts are divided into 2 main categories, intentional and unintentional. Intentional torts are those offenses where there was intent to cause harm. Examples of these include assault, battery, false imprisonment, defamation, and breach of confidentiality. Unintentional torts are those offenses where there was no intent to cause harm, and this is where negligence and malpractice come in. For example, coercion of a rational adult patient to place an IV would be considered a tort and considered assault and battery. Negligence occurs when a nurse does not act in a reasonable and prudent manner, with resultant damage to a person or a person's property. For example, if a nurse aide fails to clean up orange juice on a patient's floor and the patient falls, this would be considered negligence. Negligence is an area of tort law that involves harm caused by carelessness, not intentional harm. Malpractice is professional negligence by act or omission by a healthcare provider in which the treatment provided falls below the accepted standard of practice in the medical community and causes injury or death to the patient, with most cases involving medical error. Nursing malpractice occurs when the negligence of a nurse causes injury to a medical patient. This usually occurs in a hospital setting, but it can also happen in a retirement home, convalescent home, or at a private residence. In short, wherever a nurse works. For example, a nurse could commit malpractice by improperly administering an injection causing sciatic nerve injury. Only a professional can be sued for malpractice. Any other misconduct is classified as negligence. In order to be held liable for malpractice, a professional must fail to act as another reasonable and prudent professional with the same knowledge and education would have acted under similar circumstances. In order to prove nursing malpractice, it's usually necessary to prove that the nurse was negligent. Proving negligence involves showing that the nurse disregarded or breached the standard of care that applies to nurses in a similar field. This breach must be the cause of the patient's injuries, and the injuries must be calculable into a monetary figure. Therefore, malpractice must have these four components. It must be established that the nurse had a duty to the patient. A breach of standards of care or failure to carry out that duty must be proven. The patient must suffer actual harm or injury. Finally, there must be a causal relationship between the breach of duty and the injury suffered. Rule of personal liability is that every person is liable for his own tortuous conduct or his own wrongdoing. A physician cannot protect a nurse from an act of negligence by bypassing this rule with verbal assurance. Nurses are liable for their own wrongdoings in carrying out physicians' orders. This rule is relevant to nurses in the areas of medication errors and administration of IV fluids. Nurses have a legal and professional responsibility to be knowledgeable regarding the IV fluids and medications that are administered. Over 90% of hospitalized patients will receive some form of intravenous therapy during the course of their care. And IV medication administration represents one of the highest risk, most invasive procedures performed by nurses. Furthermore, it has been reported that 61% of the most serious and life-threatening adverse drug events are related to IV therapy. No wonder IV therapy-related lawsuits are at an all-time high. At the national level, the American Nurses Association and the Joint Commission on Accreditation of Healthcare Organizations, or better known as the Joint Commission, along with various specialty organizations, established the standards of nursing practice. Therefore, in addition to the standards set forth at the state level in the ORC and OAC, nurses must adhere to national standards of practice set forth by these agencies. There are physical hazards associated with IV therapy, examples of which include needle stick injuries, abrasions, chemical exposure, and latex allergy. For these reasons, the nurse performing IV therapy must adhere to OSHA and CDC standards. Another agency that develops standards for IV therapy is the INS, or Infusion Nurses Society. Not only does the INS develop standards, it also offers certification for its members. Also, specific standards are set forth in hospital and agency procedure manuals. These standards must be compliant with law and rule, which means that they cannot give a nurse permission to do something that law and rule forbids. However, at times, facility policy may be more restrictive than law and rule. For example, under the LPN scope of practice, an LPN may change a central line dressing. The hospital where this LPN works, however, may have a policy that states that LPNs in this facility may not change a central line dressing and only RNs may do so. After the standard of care has been established and legal duty has been shown in negligence cases, the injured party must prove that breach of duty has occurred. Examples of breach of duty include those shown on this slide: delay in administration of medication, unfamiliarity with the drugs, inappropriate route of administration, failure to clarify orders, and negligence in patient teaching. Informed consent must be obtained prior to initiating IV therapy. The purpose of informed consent is to provide patients with enough information to enable them to make a rational decision whether to undergo treatment. The patient should understand the procedure, must not be coerced, and be capable of giving consent. Duty to obtain consent belongs to the person performing the procedure or anyone who knows consent was not obtained. Even though your facility may not require a separate written consent to initiate IV therapy, legally, you still have the responsibility to fulfill the requirements of consent and document that this was done. Next, we will review the laws regulating the practice of IV therapy by LPNs in the state of Ohio. Then we will review the corresponding rules. Law that regulates LPN practice of IV therapy is found in Chapter 4723 of the Ohio Revised Code. Please make sure you have printed the handout listed on Canvas or have it available on another device before you continue with this lecture. For the rest of this unit, we will be reviewing the specific laws and rules that relate to IV therapy. It is important that the LPN be familiar with these laws and rules. Please be sure to read them thoroughly. We will focus on Chapter 4723-18. However, it may also be useful for you to review the definitions found in Chapter 4723-01 on your own. As you will see, Chapter 4723-18A sets forth the qualifications for an Ohio LPN to practice IV therapy, including holding a current valid license and completing a course of study, like this one. Basic curriculum requirements are set forth here, including the 40-hour requirement and skills testing. Further curriculum requirements are set forth in the OAC, which we will consider shortly. Chapter 4723-18B restricts IV therapy by LPNs to adults only. This chapter lists the individual authorized to direct the LPN, which includes a physician, physician assistant, dentist, optometrist, podiatrist, or registered nurse, as long as that individual is present and readily available at the facility where the IV therapy is performed. 4723-18C indicates that when the RN is directing the LPN for IV administration, that RN must be readily available in the facility and also must perform the initial assessment prior to the LPN initiating IV therapy. An example of this would mean that the RN would assess the patient, the IV site, appropriateness of medication, and relay what therapeutic or adverse effects to monitor for. Also, while the IV is infusing, an RN must be on the premises and readily available. Section 2 gives the provision that if the IV therapy is in a home, such as an intermediate care facility for individuals with developmental disabilities and so forth, the RN directing the IV therapy may be accessible by telecommunication or on the premises. Part D lists procedures that LPNs are prohibited from performing. LPNs may not initiate or maintain blood or blood components, solutions for total parenteral nutrition or TPN, and cancer medication. In addition, LPNs may not administer solutions through a central or arterial line that aren't among those solutions listed in D6A. Finally, LPNs may not administer any investigational or experimental medications through the IV line. Part 2 restricts the LPNs only starting IVs in the veins of the hand, forearm, or antecubital fossa. Part 3 prohibits the LPN from discontinuing a central or arterial line or any line that does not terminate in a peripheral vein. In other words, the LPN may only discontinue an IV that he or she could have initiated. And Part 4 prohibits the LPN from starting or discontinuing a PICC line. Part 5 restricts the LPN from reconstituting or mixing any medication except for antibiotics that are administered via IV. Part 6 lists the only IV solution that LPNs may administer. In Section 1, we see that LPNs may initiate dextrose 5%, normal saline, lactated ringers, sodium chloride 0.45%, sodium chloride 0.2%, and sterile water. In Section 2, we note that the wording is different. In the case of one of these solutions that also contains vitamins or electrolytes, the LPN may only hang subsequent containers. The RN must initiate these infusions. Finally, in Section 3, the law gives permission to the LPN to administer antibiotics. Part 7 prohibits the LPN from changing tube on a central or arterial line, but does allow the LPN to change tubing for a peripheral line. Part 8 prohibits the LPN from programming or setting any function of a patient-controlled infusion pump, or a PCA. Part E lists the laws regulating activities related to performing dialysis. And Part F states that the employer must verify the LPN's authorization to perform IV therapy before directing the LPN to do so. This part of the law lists what an LPN may perform without being IV certified. The LPN must still be directed by one of the same individuals previously listed who is readily on site or accessible by some form of telecommunication. The LPN must be able to demonstrate the knowledge, skills, and ability to perform the procedures listed safely. These include verification of the type of peripheral IV solution, examination of a peripheral infusion site in the extremity for possible infiltration, regulation of a peripheral intravenous infusion according to the prescribed flow rate, discontinuation of a peripheral IV device at the appropriate time, and performance of routine dressing changes at the insertion site of a peripheral venous or arterial infusion, PICC infusion, or CVP subclavian infusion. The OBN rules that regulate nursing practice are contained in 23 chapters in Section 4723 of the Ohio Administrative Code. Section 4723 is also referred to as the Ohio Nurse Practice Act. We will next do a brief overview of the rules regulating IV therapy, so it would be advisable to print a copy of these rules or access the website link listed on the slide. In this chapter, definitions of these terms are provided. Adult means anyone 18 years of age or older. Antibiotic includes anti-infectives and antifungal. Initiate means to start or begin, and maintain means to administer or regulate an IV infusion according to the prescribed flow rate. Finally, piggyback means an intermittent or secondary IV infusion. Note on the picture on this slide, the piggyback is hung higher than the primary bag and connects into the primary line. As you will note, the prohibitions listed here are the same as those provided for in the law that we reviewed earlier. These prohibitions include initiating or maintaining blood or blood components, TPN, cancer medications, investigational or experimental medications. Administering any solution not listed as allowed is also prohibited, as is administering any piggyback other than an antibiotic. The LPN is prohibited from discontinuing any IV other than the one that terminates in a peripheral vein. In Rule 4723-17-03, Part A3, not only is the LPN prohibited from initiating or discontinuing a PICC, the rule also prohibits initiating or discontinuing any catheter that is longer than 3 inches. Additionally, programming or setting any function of a PCA is prohibited. Again, programming or setting any function of a PCA is prohibited. There's also prohibitions in any mixing or reconstituting for IV therapy except for antibiotics. And finally, there's prohibition in administering any medications via the IV route by the LPN except antibiotics. The LPN is also prohibited from injecting medications by a direct IV route, sometimes referred to as IV push. The LPN is allowed to administer a heparin or saline flush only. The LPN is also prohibited from changing tubing on an arterial line or central line, but does allow the LPN to change the tubing on a peripheral line. There is also a prohibition for the LPN from changing an intermittent infusion device, but this law also allows the LPN to change the device if the tip of the catheter terminates in a peripheral vein. 4723-17-03 Part B clarifies the procedures that the IV certified LPN may perform on an adult under the direction of the physician, dentist, optometrist, podiatrist, or registered nurse. The LPN is allowed to administer what the law allows, which includes D5, normal saline, 0.45, LR, 0.2, and sterile water. The wording of the law stated that the LPN could administer one or more of these solutions, so the rule clarifies this further by adding a few commonly used multiple solutions, such as D5LR and D5 normal saline. Like the law, the rule states that the IV certified LPN may administer any of these solutions that had vitamins and electrolytes only after the RN has initiated the first bag. Furthermore, this rule clarifies that the LPN may administer antibiotics and provides that the LPN may reconstitute these antibiotics. The continuation of this rule allows heparin or normal saline flushes. Note that this rule does not add any restrictive language, so these flushes are allowed for central and peripheral lines. Rule 6 allows tubing changes, but like the law, only on peripheral lines. The LPN may not change the tubing on a central line. Number 7 reaffirms that the LPN may place a catheter no longer than 3 inches in length in the hand, forearm, or antecubital space. And Rule 8 allows the LPN to stop an infusion of blood or blood components or turn off a PCA when a complication arises. This part of the rules again repeats the information with regard to who may direct the LPN. Part D is similar in wording to the law found at 4723.181, which clarifies what a non-IV certified LPN may do. Rule 4723-17-06 sets forth the minimum curriculum requirements for this course. It specifies the mandated content areas, which you will find listed here. It also sets forth the requirement for laboratory practice and skill testing, and states as written on your slide that the practice of all skill components and skills testing shall be done in either supervised clinical practice or while supervised in a laboratory. Like a registered nurse, a licensed practical nurse must data collect, plan, implement, and evaluate client response to nursing care. LPNs, however, must work under the direction of a registered nurse, licensed physician, dentist, optometrist, chiropractor, or podiatrist. With all areas of nursing practice, the rule noted on this slide applies. The same is true of IV therapy. The IV certified LPN must maintain current knowledge of IV therapy, both with respect to the scope of practice and standards of care. Laws and rules change. The LPN must stay current. Standards evolve as research progresses, and the nurse must know what the current standards of care are. The nurse must also stay competent and only perform nursing tasks for which he or she is currently competent. As with all other orders, the IV therapy orders must be implemented unless one of these conditions is met. Those include that the order or direction is inaccurate, not properly authorized, not current or valid, harmful or potentially harmful to a patient, or contraindicated by other documented information. In this case, the next slide applies, where the nurse must clarify the order. A licensed practical nurse shall, in a timely manner, clarify any order or direction for a patient when the licensed practical nurse believes or should have reason to believe the order or direction is inaccurate, not properly authorized, not current or valid, harmful or potentially harmful to a patient, or contraindicated by other documented information. An LPN must maintain knowledge, the laws regulating the practice of nursing, the rules of the board, position statement standards for practice or rule, and guidelines for practice of nationally recognized nursing entities. An LPN must maintain consistent performance of all aspects of nursing care according to acceptable and prevailing standards. Appropriate recognition, referral, or consultation and intervention when complications arise during or after the performance of a specific function or procedure. The LPN should also know the information provided by Ohio law and Ohio Board of Nursing rules. This includes type of solutions, electrolytes, vitamins, antibiotics, the information in starting the IV therapy, who, where, and the catheter length, the discontinuing information, any prohibitions, piggybacks or reconstitution, central lines, what's allowed and what is not allowed, and who is to be overseeing the procedure. In summary, it is important for you to know what procedures are authorized and which procedures are prohibited for the IV therapy certified LPN. Be sure you understand the difference between a peripheral and a central catheter, and how and what you are allowed to do varies depending on the location of the catheter tip. Know which solutions are allowed, the rule about vitamins and electrolytes, and what kind of oversight you will need depending on the type of facility you work in. In discussing central lines, this is just a quick review of what you have to keep in mind. Can the LPN initiate, maintain? What types of fluids? Can they flush? Can they use vitamins and electrolytes? Antibiotics? Can they discontinue a central line? Can they change the tubing on a central line? Can they aspirate? And what oversight is necessary with a central line? In summary, just because the initiation of IV therapy is legal does not mean it is ethical. Do they want it? Ask yourself, do I know enough about it? Do I know how to recognize adverse reactions and what to do about them? Is it safe here, now, with me and this patient? Regardless of nursing procedures indicated, the general rule of thumb is, when in doubt, don't. It is a prudent guideline for all nurses to follow. In a court of law, proven adherence to the standards of safe nursing practice is the nurse's primary defense.